If you think that you or someone you know may have endometriosis, or if you just want to know more about this illness, this film will help you to understand it better. Endometriosis is a common condition which affects women in their reproductive years, that is, from the onset of menstruation to menopause. The condition often causes pelvic pain, which is pain that is felt low down in the tummy. It occurs in single and married women from any culture group or part of the world. It is not infectious, so cannot be passed from one person to another. The endometrium is the lining of the womb, also called the uterus. When someone has endometriosis, some of this lining grows in other parts of the body. Mostly this is in the pelvis, lower tummy, but it can sometimes occur in other places such as the lungs or liver. The most common places where endometriosis happens are in or on the fallopian tubes, the tubes that take the egg from the ovary to the womb each month, on the ovaries, where the woman's eggs are produced, behind the womb, the tissue that holds the womb in place, on the bladder, on the bowel. This lining, like that in the womb, bleeds every month during periods. This blood has nowhere to escape and causes soreness and pain.
I started having severe period pains 3 years after I started my periods. I would be sick and sometimes collapse from the pain. This condition worsened and the bleeding got heavier over 2 years, and my GP referred me to my local hospital. I was prescribed with a contraceptive pill to help. One day at work, I collapsed with bad pain, and I was not even on my period at that time. I was taken to A&E and later diagnosed with fibroids. I was given medication for this. A friend told me about endometriosis and I went to see her doctor. I had a laparoscopy and was diagnosed with endometriosis. I have since tried a number of medications and later had surgery to remove endometriosis. I was relieved to be diagnosed because all along I thought it couldn't just be fibroids. I have recently got married and hope to have children one day, when we're ready as a couple to do so.
There are many symptoms of endometriosis, and they often depend on where the endometriosis is. The most common symptom is pelvic pain, which can be very severe. For some women, pain is worse during a period, but other women experience pain most of the time. Other possible symptoms include painful bowel movements during periods, pain on passing urine during periods, pain in the lower part of the back. Some women with endometriosis find it difficult to get pregnant. However, experiencing a combination of these symptoms does not necessarily mean you have endometriosis. A woman can have endometriosis without having troublesome symptoms, and only find out that they have it when they have investigations or surgery for other things. Often, women find friends and family think that the symptoms are normal or just period pain, but endometriosis is a disease that can be treated. No one knows what causes endometriosis, or why only some women get symptoms. There are various theories. Research studies are being carried out to try and understand endometriosis better. Many women with endometriosis achieve a pregnancy easily. However, around 40% of women who attend infertility services are found to have endometriosis, so there can be a link. This is probably because the fallopian tubes become blocked, or because scarring that can occur during surgery pulls the reproductive organs out of position. Doctors will decide on an individual basis whether it is better to treat endometriosis before embarking on fertility treatment. Anyone who has very painful periods that seem worse than those of friends and family, or finds that their life is disrupted by pain, should see their doctor. Keeping a note or diary of when the pain is felt and how bad it is may help the doctor decide that it could be endometriosis. Your GP may want to examine you internally, so if you'd prefer a female to do this, you should make this known at your doctor's surgery. Your GP may also refer you to a specialist at the hospital. Scans may suggest that a woman has endometriosis, but the only sure way of knowing is via a laparoscopy. This is a short operation where a doctor puts a tiny camera through a small hole in the tummy and looks for endometriosis. She or he may take a small sample of tissue, known as a biopsy, which is then looked at under a microscope. Endometriosis is usually classed as mild, moderate or severe.
I have had severe endometriosis, with symptoms starting from age 10. I have had a series of treatments including surgery, the oral contraceptive pill and injections to stop my periods. I have also explored complementary therapies in addition to medical treatment. My mum took me for acupuncture. I had one session but I was not keen. I also tried homeopathy but did not notice any difference. I think it just did not work for me. I then started seeing a nutritionist who advised not to eat red meat, to eat more fish and white meat and avoid dairy products. I also did a lot of my own research, and one day I just decided to become vegan and pull the plug on all my dairy products, all my meat and fish, and I have been vegan ever since. Since I became vegan, I have noticed a big difference in my body. My everyday pains have dropped by at least 80%.
There is no cure for endometriosis, but there are treatments that can help the pain and may improve quality of life for some time. Getting treatment early may also improve the chances of getting pregnant if fertility is affected. Endometriosis can affect many parts of a woman's life, such as relationships with friends and family, intimacy with a partner, ability to work and carry out duties in the home. Knowing what causes the pain often helps women and those around them to understand it and cope better. It is really important that partners understand the condition and how it can make women feel. Treatments are both medical and surgical, depending on how severe the disease is and whether a woman wishes to have children. Your doctor should discuss the choices with you, and you can decide which is best for your own circumstances. You may need to try a number of treatments before you find the one that reduces or relieves your pain. Symptoms of endometriosis may return after a while. You may therefore need more than one course of treatment. Most women will require pain relief for at least some of the time, which may be with anti-inflammatory drugs such as ibuprofen or stronger pain control available on prescription. Pain during sex may be helped by a change in position or finding different ways to have sex. A referral to a sex counsellor can also assist with discussing more comfortable positions. The first hormone that women are offered is often the contraceptive pill, as it stops the effects of the hormones that can cause the pain. This can be offered to married and unmarried women, even when they are not sexually active. Other hormones can cause periods to stop, but they start again after you finish these medicines. Hormones can only be taken for a short period of time, and unfortunately, pain often returns when a woman stops taking them. Women can only use these treatments if they do not want to become pregnant during that frame of time. Surgery can be minor or major. Endometriosis may be removed by laser or by cutting it out during a laparoscopy. Even quite major surgery can still be carried out without the need for a large cut in the tummy. In very severe cases, the gynecologist may recommend a hysterectomy, removal of the womb, to women who have completed their family. This means that periods stop, and for some women this takes away the pain, but it does not work for everyone, and some women continue to experience pain. Women need to explore all options and be sure that they are happy with this choice before they decide to have the operation. There are a number of complementary therapies, such as acupuncture, homeopathy, reflexology, or Chinese medicine, which may reduce pain. Multivitamin tablets that contain vitamin B12 and magnesium may reduce period pain. Dietary changes such as not eating wheat or dairy products may help. TENS machines, which give a small electrical charge or heat, for example hot water bottles, apply to the area of pain. Relaxation and reducing stress may also help. There are websites and self-help groups where you can get information about endometriosis.